Caitlin, I can start, I guess, too, if you'd like.
Go ahead. Sorry. She had me muted.
Well, I'm Alice Harvey, Director of Public Health here at Rio Blanco County. I'll let Nikki introduce me also, and just want to thank her for the Herald for having us and giving us this opportunity here to speak with you all tonight. So thank you, everyone, for coming, and I'll let Nikki kick it off.
Thank you for taking the time to speak to everybody and answer the questions that you've been receiving. Hopefully we can get this out there to people and let them know where everything's at and what the county and public health are doing and the partners that have all come together just today, I understand, to work together on this and be planning and preparing and ready to go to deal with this virus. So go ahead.
Definitely. And again, thank you all for being here. And again, this opportunity, because I know there's so much information coming at you from so many different places and recommendations are changing daily. So I wanted to give you as much information as possible tonight that's relevant to our communities here in Meeker and Rangeley, and also direct you where to go for additional information in the coming weeks and months. So first of all, I'll jump right in. Some of the most common questions that we are receiving, I'll try to address tonight. So number one being, I think I have been exposed to COVID. What should I do? That's probably first and foremost really important to discuss. So I'd like to explain a lot of this. Again, I apologize will be repetitive to some of you, as I know you're seeing this in multiple different ways and hearing this constantly. So I really don't want to repeat too much. But it's really important to kind of explain how the disease spreads, what to expect if you do get it first. And then I'll cover what to do if you're ill and what to do if you feel like you may have been exposed. Two really important distinctions there and categories of questions that we're receiving at Public Health. Nikki, at any time, please stop me if you have any, would like to make a clarification, or if I don't, I'm not coming across clearly.
Okay.
So first and foremost, of course, as most of you know, COVID-19 is a respiratory illness caused by a virus, spreads from person to person contact through or through infected surfaces or objects. So transmission occurs through respiratory droplets, spread when an infected person coughs or sneezes, similar to how the flu and other respiratory viruses spread. So to become sick, you have to be exposed to the virus either by being in close contact within 6 feet of someone with an infection for a prolonged period of time, or by touching a surface that has the virus on it and then touching your mouth or nose or possibly even your eyes. For these reasons, people that are at higher risk of getting infected are those who have been to areas where there's widespread community transmission occurring, and we'll talk a little bit more about that later and what that means. And also people who have had direct close contact with someone who has the infection. And I'll talk about the different risk levels and kind of what that means in just a moment. But just to, again, give you a background, as far as symptoms go, the symptoms of COVID include fever, cough, and shortness of breath. I'm sure you're all probably tired of hearing that. There's a lot of details that go into that, but in general, fever, cough, and shortness of breath. It can be severe and require hospitalization. However, most individuals do recover, will recover by resting and drinking plenty of fluids and taking fever-reducing medications. However, in more severe cases, infection can cause pneumonia, severe acute respiratory distress, kidney failure, and even death. So what makes this virus different, probably one of the big questions we get from the seasonal influenza virus, is that it's a novel strain. So as humans, we've not developed any herd immunity or have no vaccine available to fight it. It's a fast-moving pathogen, so it's incredibly difficult to contain. And in order to contain it, it's going to take not only aggressive tracking and prevention efforts on our end at Public Health, but the entire population working together to stop the spread. And we're seeing this more severe illness in older adults and those with underlying medical conditions, which we will talk a little bit more about. But 8 to 10 deaths reported so far in the US have been in adults 65 and older. So we've all got to work together to contain this virus and protect those people that are at higher risk, even though many people will experience mild symptoms. Reducing the spread amongst those people is key in protecting the most vulnerable in our society. And that's why the situation is so serious. And these recommendations are and should be so relevant to each and every one of us, not just those at high risk. So I think that's really important to say. So just real quick, kind of, again, the big questions, what to do if you've been infected with COVID-19. Um, Symptoms occur within 14 days of exposure, typically within 6 days. Again, as the data keeps coming in from the CDC, we're doing a lot of surveillance, as you all probably know and hear about on the news. We're learning more and more each day. The symptoms we know do include cough, fever, and shortness of breath. And the symptoms, the severity really varies depending on an individual's risk level. So higher risk people, which is a really great question Nikki had actually already from somebody in the audience. What does that mean? People who are at higher risk, which means that they're at risk of getting more severe illness from COVID-19. We're seeing older people over the age of 60, people who have chronic medical conditions such as heart, lung, kidney disease, or diabetes, and older people with chronic medical conditions combined are obviously at the highest risk. Um, and at the first indication of symptoms, we're asking everyone to isolate. We're currently recommending a 14-day isolation period for symptomatic individuals who have a known or expected exposure. And isolation means you have to stay home and away from others until 14 days have passed since the symptoms first appeared. And it must be 72 hours after the fever's gone away and improved respiratory symptoms. But again, we'll get into some of those little details later. Really important, I'd just like to say, CDPHE and the CDC have absolutely great resources on their websites. The state of Colorado just launched a brand new COVID website, which I believe Nikki's been kind of advertising and linking, putting links out for, and it is really good. It has some great resources about isolation, and a lot of these things I'm going over tonight really put them in a good visual form. So please reach out to those sites or look at those sites and see what you can find. But what we're stressing right now is social isolation for everyone due to the fact that we know it's coming, regardless of individual travel histories right now. I mean, we know, we're being very realistic. We know it'll eventually be spreading widespread here in Meeker and Rangeley. So we want to head it off and be prepared. Even though we don't have a confirmed case in Rio Blanco County yet, there are 720 cases in Colorado as of today. And as you probably, most of you probably know, that rate of infection and rate of new cases is going steeply up. So what we're trying to do is really try to bring that down. So we're absolutely aware, and we would like everybody to be aware that it more than likely we will have ongoing community spread here in our towns very, very soon. We're treating it very seriously in that way. And the reason for that is, again, we need to protect everybody before it hits. We'd like to make some big efforts in prevention. So a couple of specific questions about transmission and exposure. Number one question we get about travel is, what if I've traveled to an area where there's a known community spread, positive tests, so say Grand Junction, Steamboat Springs, Glenwood Springs, but I'm not symptomatic. What does that mean? So if this is the case, you do not need to get tested, but you do need to watch closely for symptoms and do what we call self-monitor. You then isolate yourself if you begin to experience symptoms and call public health. So if you have symptoms at this point, we are asking that people self-isolate, except to seek medical care. And I will go over that. The next question that Nikki had was about testing, and I will talk a little bit more in detail about that, who needs to get tested and how and when and where. But it's really important to understand that at this point, we're assuming that anybody could be infected. If you have the symptoms of fever, cough, or shortness of breath, we want you to self-isolate, and we want you to reach out to public health so we can give you and your family specific recommendations. We want you to go to the doctor if you need medical care, but we want you to call ahead. There's some new options that have been made available by both of our local hospitals that started this week, and I'll go over those in detail. So it's really important to understand community spread means people have been infected in a community without that travel, that we don't know where the source was or how they became infected. So we have not, again, had that positive test here. However, we are fully aware that those areas are surrounding us in Rio Blanco County. So although we might be a couple of weeks behind some of these larger mountain communities with more tourism, like Summit, Eagle, Pitkin, for example, which I'm sure you've all heard, we want to be prepared and assume that we do have the infection here. And I hope that clears up something about, in terms of exposure, what do I do? And then when it comes to isolation and quarantine, really, in short, does everybody in Meeker or Rangeley who's traveled anywhere outside of RBC in the past 14 days need to be isolated? The answer is no, but we have to be hyper vigilant at all times in an effort to head this off. And so we need to socially isolate as much as possible. This is why the schools and restaurants are closed and why CDPHE is recommending that anyone who can work from home does, and everyone in general, socially isolate, so as to prevent the spread before it is widespread in our community. But if you feel like you have symptoms of fever, cough, shortness of breath, you do at this point need to stay at home and call public health so we can give you more specific recommendations. And then in terms of quarantine, if you've been in close contact with someone who highly suspect has been diagnosed with COVID, and this will, again, as we see it here, this will increase in frequency, but we'll have people who were in close contact, by definition means that you were within 6 feet of someone for longer than 10 minutes who has COVID. That is the definition, the CDC's definition of close contact. In that case, we are recommending a 14-day self-quarantine period. So the difference between quarantine and isolation, quarantine being that you're not yet infected, but we're keeping you at home just in case so that you don't spread that virus to others when you're at that really high risk of having it because of your close contact with someone who had it. So this is what we're currently advising anybody who has been tested or has symptoms that are highly suspicious of COVID. At Public Health, we are recommending that those individuals quarantine for 14 days. Again, because we realize that even though there has not been a positive test here yet, it's right on our doorstep. And so we want to prevent that occurring from the outset. And so let me stop there, Nikki, and ask you if you have any other questions about what to do when you feel like you have symptoms or have been exposed, and then we can move on to kind of the who and what and where for testing.
Hey, that takes me right into testing, basically. You answered my question about what close contact means, the difference between isolation, social isolation, and quarantine. Those are all good things, that all terms we've come to know in the last week.
All too well.
Yeah. So then if somebody does have symptoms, I know there's been a lot of discussion about who can get a test and who can't get a test, and what does the test entail. There was some discussion today from the White House as far as, this test is just, it's uncomfortable and invasive. So can you give us a little bit about that?
Yeah, absolutely. And so I really do like the way a lot of what's being put out right now on purpose, guidelines that are simplified. So the 15 days to slow the spread really states if you feel sick, stay home. And then contact your medical provider if you need medical care. So that's the general take home. If your children are sick, keep them at home. Obviously, that's why our schools are closed, but keep them at home. And then contact your medical provider if you need medical help. So to clarify, in Rio Blanco County, what that means, a few things, because again, this is what is rapidly changing as new testing options do become available. So it's important to understand our website, www.rbc.us. Nikki does have that link on her website. We are putting all of the most recent testing recommendations, locations on that website. We'll also be doing it via Rio Blanco Alerts. So a lot of this will continue to push out a lot more details to come in the coming weeks than we have in the past as we come closer to having it in our community. So please know that these will change. And the CDPHE also outlines this very well on their frequently asked questions page. They do a great job of testing FAQ. In short, so whether or not you're diagnosed with COVID, if you don't need to be hospitalized, your treatment will be the same no matter the test result. So ideally, everyone who wants a test would be able to get one. And right now, that's obviously not the goal on either a federal, state, or local level. So we've been very lucky in Rio Blanco County because we have had 2 hospitals that have been willing to work with us on testing since day one. And so it has been available here because of that. And they will continue to work with us closely. So as we begin to see cases in our community, additional testing options will be available in the form of a community testing site that Public Health will will be able to offer in addition to what we currently have with our local hospitals. And so please look out for those soon to come details for those. But we don't currently have a community testing site being run by public health. So all of the citizens of the county, of course, are advised first and foremost to self-isolate for 14 days as soon as the suspect symptoms appear, except to seek medical care. And then they're encouraged to contact public health, and we can give you specific recommendations based on your risk level for testing. So we're happy to do that. For people whose symptoms are severe enough to need medical treatment in a hospital, a positive or negative test result is important because obviously the diagnosis will help the hospital decide what interventions the patient needs and how their care should be managed. 24/7 emergency medical care, of course, still remains available via our local emergency departments. But in an effort to allow our hospitals to care for those who are ill, we're asking that you don't visit the ED or call 911 for information about testing alone. Asymptomatic individuals do not require testing. We are not recommending tests for anyone who doesn't have symptoms, first and foremost. And then testing is optional. So please also understand that testing is not required. We are not advising, and CDPHE does not advise employers to require tests of their employees. We're happy if you have issues with your employer about this, please direct them to public health and we can provide them with those recommendations and guidelines, because that's really important to understand that testing is not, number one, not for individuals who are not symptomatic, and also not for just to have for the record to be cleared to go back to work. It's not necessary. So if your symptoms are mild and you're medically stable, of course, the emergency, I just can't stress enough, if you're having difficulty breathing and you need to see a medical provider, the same options are available to you at Pioneers Hospital and Rangeley District Hospital. We just ask that you call ahead. If you feel like you may either have been exposed or have these symptoms, fever, cough, or shortness of breath, that you call ahead of time to let them know you're coming, and that will allow them to prepare so that they can, again, give you a mask when you arrive. They can be wearing appropriate PPE, which includes masks, so that we reduce that chance of spreading the infection to other people there. So that's really important to understand. But if you are, again, you're medically stable, but you're seeking medical care and you suspect you might have COVID, the following options are available. There's a couple of different options right now, and they're different in Meeker and Rangeley. So I'll talk about Rangeley first. Rangeley District Hospital has set up a drive-through testing clinic at the hospital. It'll be available Monday through Friday from noon to 2 for individuals where testing is indicated. And there is a number that they can call, and I will have that posted on our website. I can actually say it right now too, just in case anyone's taking notes. The number for Rangeley, the Rangeley drive-through testing clinic is 970-620-3969. That phone line will be manned in Rangeley by Rangeley District Hospital Monday through Friday from 8 to 4. So people can call and, again, talk to someone to talk through whether or not a test is indicated for them or necessary, what their options are for medical care, and then they can schedule that testing through that drive-through clinic if that's what they decide to do. So that's in Rangeley. In Meeker, this week also the Pioneers Hospital opened a respiratory clinic. And this is, again, for symptomatic individuals who would like to be seen by a medical provider for a number of issues, but any respiratory complaints, including these symptoms of fever, cough, and shortness of breath, that they come to the hospital. Testing will be completed if indicated by order from a physician at that time. It is going to be Monday through Friday from 1 p.m. to 4 p.m. And during those hours, what you do is go to Pioneers, follow the signs to the respiratory clinic that's located on the east or the north, the Craig side, the east side of Pioneers campus. So there will be signage directing people. So those are the two current options for testing here. And again, it's not required. It's if you are medically stable and you don't feel like you need to see a doctor, you absolutely can self-isolate. Do not wait to get a test. You do not need a test in order to self-isolate. So we would prefer that you self-isolate right away. If you are high risk, which I talked about earlier, you've been to one of those places where you know it's ongoing, you've been in close contact with someone, anything that would concern you for being high risk for exposure for COVID, please call public health and we will give specific recommendations for you and your family. And then those are the two places currently where people have been getting tested is at the hospital by appointment with their doctor, which again is still something that we don't want to give the impression that we don't want people to seek medical care if they should need it. But it's definitely not necessary to go to the doctor to get a test if you do not feel like that is needed. You can also just self-isolate and follow our recommendations and manage this from home. Once the virus, again, like I said, is spreading in our community, the state will be providing me at Public Health with a large number of tests, and I'll talk about what those tests are like. You're right, Nikki, they're not pleasant. They'll be providing us with a larger number of test kits so that we can set up a drive-through clinic. We'll probably be doing, well, we will be doing it at the fairgrounds. Again, the details for where and when and how that'll work are still to come, but we'll be setting up probably a couple of times a week. We will be setting that up so that people can do a similar thing. Call a number ahead of time, get recommendations from public health before you come. And then if you choose to get, you do want to come and get tested, you'll go through a line where you'll get to have a quick medical assessment and triage from a nurse or an EMT, and then move on and get a test and education and instructions for home. And then of course, still, if you do need that medical care, we will absolutely be able to facilitate getting you to see a doctor at Pioneers Medical Center. And then in Rangeley, a similar situation. So I hope it is confusing, and I recognize it's confusing. However, one thing to rest assured, knowing we have been testing here, we are actively testing and managing persons under investigation is what we call people who have had a test that are waiting for results, or people who we're highly suspicious of having COVID based on some of that criteria like travel and risk level. And so again, happy in the next couple of weeks while we still wait for that positive test here. We're very, very happy to answer those questions on a case-by-case basis. For anyone who is concerned or confused, we definitely want to be here to answer those questions so that you don't have to overwhelm the hospitals with calls or questions or just go up there to get tested. That's definitely not what we want at Public Health. What questions do you have about that, Nikki? Oh, and the test itself, let me cover that. I apologize. The test, it does involve getting a swab from a sample from your nasal cavity, actually nasopharyngeal. If anyone's ever had a flu test, it's the same thing. So it is a plastic, it's like a Q-tip. I don't have one to show you, but the nurse or whoever's doing the test will insert the test swab into your nose, and it goes back into your pharynx. That is then pulled out and put into a test vial and sent to the state lab. It is not pleasant. Definitely is uncomfortable.
How many tests have we done in Rio Blanco County at this point?
Actually, at this point, I don't have that number off the top of my head, but I can tell you that we tripled, at least tripled just over the weekend.
So wow.
We've started doing a ton more. Yeah, we're doing that on both ends of the county. So right now we're in the process of really ramping up, and that's why we expect to have a positive here pretty soon, because we have been sending off more and more people meet those criteria. And then once we have positive cases here, and we very much expect that to be soon, and we have community transmission occurring here, of course, then even more we want to focus on the instructions that we give people to watch for any of those symptoms and then self-isolate before anything else, except to seek medical care, of course. I really hope that gives some clarity. Please look out on our website for those detailed kind of step-by-step instructions on what to do in Meeker and Rangeley if you're looking for either medical care or testing. That will be in writing, and probably we'll try to push that out in multiple different ways in the coming week or so.
Okay. And then I think there was one, is that all the questions that you had prepared?
I had one more was what can I do to help? I think that's really important. Um, most importantly, again, it's practicing the social distancing and trying to keep 6 feet between yourself and other people whenever possible. Particularly when you or others are sick, working from home if you can, keeping children and teens from gathering in public places, even though school is closed. I know that can be really hard. Um, Avoiding group gatherings. We most people know by now, by public health order, we're asking that there are no gatherings of greater than 10 people in any given space. Just a good general rule. But we also want to emphasize, I know that's the stuff you've heard over and over again in our community. Spreading the word to anyone in your life that may be at higher risk is so important. For example, you have a parent or a grandparent who may fall into that category of high risk, either by their age or due to a condition that they have. Just reaching out to them by phone, letting them know that you're thinking about them, helping to explain social distancing. That can be really hard to wrap your head around, especially if you're not watching the TV constantly and hearing it over and over again. So please try to spread the word. We are working on multiple different volunteer opportunities in the coming months that we might be. Please check the county website for notices and updates. But we have this incredible community already. So many people are doing so many things in terms of how we're going to support each other in the coming months, because we recognize it's one thing for us to ask people to socially isolate, but and then potentially be living that for months at a time. We really want to make sure that we're there to support one another. So right now, I think the best thing we can do is educate each other. Find if there's someone doesn't quite understand what social distancing is, reach out to them, explain it to them, offer your help and your support in whatever way you can, and then look out for some more formal, structured programs that we're hoping that we can kind of put together, outreach for different in various ways. So please look out for that.
Okay. What's the plan? It- we don't want this to happen, and that's why social isolating and all of these things are so important. But at some point, if resources begin to run low and everything is strapped, what's the plan at that point?
Yeah, and when you talk about resources, of course, there's at public health and the hospitals. We're working really hard to make sure that there's enough healthcare resources for everyone. But in terms of, day to day, groceries, toilet paper, I think that is a really good question. And again, I think, we've been hearing from all our community partners from the beginning of this, whether it be hospitals or schools or towns, community groups. I couldn't be more impressed with the actions that have already been taken just to plan ahead for the future. So I definitely want people to know. I think right now it's important to just to decrease some of that anxiety and letting people know there are lots of groups in town and a lot of things going on in terms of planning to support everyone. A great example of that would be the food bank. When we realized, holy moly, what do we do about the food bank? It was almost instant. Everybody said, you know what, here's what we can do. We've got volunteers, we'll box stuff up, we'll create a drive line. So that was something that, again, we may not know what all the challenges are going to be, but I think that as a community, we're going to come up with ways to really reach out and support those who are the most vulnerable. And I think we all play a role in that as well. So definitely keep checking our county COVID website, and Facebook, Nikki, the Herald, as we'll be posting a lot of these community notices as the situation continues to evolve. And I believe that will really help. And again, this community is amazing. Both Meeker and Rangeley have already done so much just to support each other, as I know you all probably know. What else? What other? I'm definitely, my voice is holding out. So if you have any other questions, I'm happy to clarify any of those.
I think that answers that answers the questions that we've had. We haven't had anything else come in. If things come in, if people have questions and they want to either email us or contact us through Facebook, then we will share those with you and give you a chance to answer those questions. And thank you so much for your time way after work hours. And
No problem.
yeah, much appreciated. And I think our community appreciates the leadership.
Definitely happy to answer any questions. Let me know.
Okay, thank you. I think that's about it for tonight. So let's all go home
right.
and wave at each other from far away.
Okay, sounds good.
Okay, thank you.
Guys, thanks everybody.
Bye-bye.